Welcome. Have you ever heard of toxic optic neuropathy? It's a rare but serious eye condition that can lead to significant vision loss. In this video, we'll explore what it is, what causes it, and what can be done about it. Toxic optic neuropathy, as the name suggests, is caused by exposure to toxins that damage the optic nerve. This nerve is crucial for carrying visual information from the eye to the brain. Many substances can potentially be toxic to the optic nerve. These include medications like ethambutol, isoniazid, and myodarone. Other culprits can be industrial chemicals like methanol and ethylene glycol, and even nutritional deficiencies, particularly deficiencies in B vitamins like B12, can play a role. In some cases, even excessive alcohol consumption over long periods can contribute to toxic optic neuropathy. Identifying the specific toxin is crucial for effective management. The damage in toxic optic neuropathy unfolds at a cellular level. The toxins directly injure the retinal ganglion cells and their axons, which form the optic nerve. This damage disrupts the nerve's ability to transmit visual signals efficiently. The central part of the optic nerve, specifically the papillomacular bundle, is often disproportionately affected. This bundle carries fibers responsible for central vision, color vision, and visual acuity. The result is a characteristic pattern of vision loss that often affects central vision and color perception more than peripheral vision. Toxic optic neuropathy is considered relatively rare. Exact incidence and prevalence figures are difficult to obtain because it is frequently underdiagnosed or misdiagnosed. Certain populations may be at higher risk, such as those undergoing treatment with specific medications known to be toxic, individuals with nutritional deficiencies, or those exposed to industrial toxins. Public health initiatives focusing on awareness and safe medication practices are essential for reducing its occurrence. The symptoms of toxic optic neuropathy can vary depending on the severity of the damage. Typically, individuals experience a gradual, painless loss of vision in both eyes. Color vision is often significantly affected, with difficulty distinguishing between colors, particularly red and green. Reduced visual acuity, or sharpness of vision, is also a common symptom. Some people may notice a central blind spot, known as a scotoma. It's important to note that symptoms can develop over weeks or months, making early detection challenging. Diagnosing toxic optic neuropathy requires a comprehensive eye examination by an ophthalmologist or neuro-ophthalmologist. This includes assessing visual acuity, color vision, and visual fields. A dilated fundus examination helps visualize the optic nerve head for signs of swelling or pallor. Further testing may include optical coherence tomography (OCT) to assess the retinal nerve fiber layer thickness, and visual evoked potentials (VEP) to measure the electrical activity of the optic nerve. Blood tests are also performed to rule out nutritional deficiencies or other underlying causes. Finally, a thorough medical history is crucial to identify any potential toxin exposure. While toxic optic neuropathy isn't strictly classified into distinct types, like some other conditions, it's helpful to characterize it based on the suspected toxin and the pattern of visual field loss. Some toxins may preferentially affect certain areas of the optic nerve, leading to variations in symptoms. The severity of the condition can also vary considerably from mild visual disturbances to profound vision loss. The primary treatment for toxic optic neuropathy involves promptly discontinuing the offending toxin. This may require a change in medication, removal from an occupational hazard, or addressing nutritional deficiencies. Supportive measures, such as vitamin supplementation, may be beneficial. In some cases, corticosteroids may be considered to reduce inflammation, although their effectiveness is not consistently proven. Regular monitoring of visual function is crucial to assess response to treatment and detect any progression. Prevention of toxic optic neuropathy centers around minimizing exposure to known toxins. This involves using medications judiciously and adhering to recommended dosages. Individuals taking medications with potential optic nerve toxicity should undergo regular eye examinations. Workplace safety measures should be implemented to protect workers from industrial toxins. Maintaining a balanced diet rich in essential nutrients, particularly B vitamins, is also important. Moderation in alcohol consumption is advised. The prognosis for toxic optic neuropathy depends on several factors, including the severity of the damage, the promptness of diagnosis, and the effectiveness of treatment. Early identification and removal of the toxin significantly improve the chances of visual recovery. However, in some cases, irreversible optic nerve damage may occur, leading to permanent vision loss. Research is ongoing to develop more effective treatments for optic nerve damage and to identify biomarkers that can predict prognosis. Newer studies are investigating the potential role of neuroprotective agents to protect the optic nerve from further damage.